Hi, I'm Lindesay Mace and I manage QSA's funeral poverty project Down to Earth. The core of the service is providing the only UK-wide funeral cost helpline for those struggling to pay for a funeral either at the time of need or when planning ahead. We aim to help people plan a meaningful funeral that is as affordable as possible. Every day, we speak to people whose grief is impacted by their constant worries about funeral costs.
I feel in the pain right now. I want my son. I can't get him back. He's dead. And I'm sitting here. I'm worrying about finding the money. I'm worrying about charity giving us the money. I'm worrying about, I have to bury my son. I'm worried about my kids. I still can't even grieve the way I want to grieve.
That was Amanda, one of our clients, and I think you'll agree with me that it's truly heartbreaking to watch. This simply should not be happening in 2021. It's a human right to be able to grieve in peace without worrying how the funeral costs for a loved one will be paid. And everyone has the right to dignity in death as in life. We work with our clients to provide them with advice and practical support suited to their situation and wishes. This can include helping them consider different options, getting quotes from funeral directors, advising them about funeral and bereavement benefits, signposting them to suitable grant-giving charities, and assisting with forms. But sometimes there just aren't enough funding options, or people are scared of the real possibility that their applications might not succeed and they'll be left in thousands of pounds of debt. In these cases, a public health funeral can be the only option. Public health funerals are provided by the local authority where the person died and are carried out when no one else is making the arrangements. That can be because there simply is no next of kin, because no one is willing, for example, due to profoundly challenging family relationships, or because there is no one able to pay. Working with our clients over the years, advocating for them and listening to their experiences of trying to access public health funerals has given us a unique insight into this issue, and we became very concerned about some of the practice and behaviour exhibited by local authorities. We saw and heard of delay tactics, shaming, and the creation of numerous barriers. It was clear that we needed to investigate to see how widespread the issue was and to use the evidence to push for change. So earlier this month, we published our report on local authorities and access to public health funerals. And while there were glimmers of light, overall, the results were deeply concerning. We selected 40 local authorities and mystery shopped by phone the 27 that had no information online for people in need of a public health funeral or no contact details for accessing one. Due to a lack of knowledge amongst the staff we spoke to, we only managed to reach the right department in 15 cases. A really clear initial barrier to anyone needing help. This is unacceptable, of course, but what most concerned us was the misrepresentation by some councils of their legal duty, effectively blocking people from accessing a public health funeral when they really need one. We were turned away by 10 of the 15 councils where we spoke to the right department. 6 of those 10 rejections were because our mystery shopper was trying to refer the death himself, rather than through a coroner or hospital. Now, this is an arbitrary distinction that has no basis in law, nor even any logic. If someone is on a low income, that does not stop being the case simply because of where or how a family member dies. Plus, official data shows that in England and Wales in 2020, coroner-reported deaths decreased and home deaths increased, reducing the chance you would have contact with a coroner or hospital anyway. The other 4 rejections were because our mystery shopper was a surviving family member, which again risks the council abdicating its legal duty by ignoring that person's financial circumstances. In 2019-2020, 5 million people were in food insecure households. If people can't put food on the table, how on earth can they pay several £1,000s for a funeral? Sadly, our survey of council websites also suggests this kind of practice is much more widespread. Where councils did hold information on their websites, 26 of the 40 we surveyed, a third of them contained inaccurate or misleading information about the circumstances in which a council must take responsibility. By speaking truth to power through producing the report, liaising with local authorities and engaging with parliamentarians, we aim to achieve change for everyone in this situation. On the most basic level, we call on local authorities to carry out their legal duty and to follow the government's public health funerals good practice guidance. But that is not enough. We are also calling for statutory minimum standards for public health funerals, including the assurance that family and friends will have the opportunity to attend a service if they wish. We also believe there needs to be better training of council staff on bereavement, the Public Health Act, and benefits.